Hi, I'm Dr. Nguyen, pharmacist. So, the FDA just warned that Tylenol use during pregnancy might be linked to autism and ADHD. But before you panic, let's break down what the science actually shows and what it does not. On September 22nd, 2025, the FDA announced it will add a new cautionary label to acetaminophen. That's Tylenol and all the generic versions. They said studies suggest a possible association between use in pregnancy and neurodevelopmental disorders like autism and ADHD. Notice the wording, association. That is not the same as causation. The FDA is not banning Tylenol. They are being transparent about the data, but they are still saying it's the safest option for pain and fever in pregnancy. So where does this data come from? Some of the largest research institutions in the world. Harvard, Mount Sinai, UCLA, UMass Lowell, and others pooled data, big cohort studies, and meta-analyses. For example, a Swedish cohort study of 2.48 million children found about 7.5% of mothers reported using acetaminophen during pregnancy. Excuse me. At 10 years old, autism was diagnosed in 1.53% of exposed children versus 1.33% of those unexposed. ADHD was 2.87% versus 2.46%. That sounds scary at first, but in absolute terms, we are talking about a difference of about 1 to 2 kids out of 100. The hazard ratio, which is a way scientists measure risk, was about 1.05 for autism, meaning a 5% bump. But when researchers compared siblings, one exposed versus one not, the risk dropped to 0.98. Basically, no difference. That's a huge clue that genetics or family environment may explain the results, not the Tylenol itself. On top of that, a recent meta-analysis reviewed 46 studies. About 27 showed a link, 19 did not. So the results are mixed, and the strongest designs, sibling or family-based studies, tend to show little or no effect. That is why the FDA is being cautious, but not conclusive. The evidence points to a possible signal, but it's not proof. So why not just avoid Tylenol? Because the alternatives are worse. Ibuprofen and aspirin are known to carry real risk in pregnancy, especially in the later stages. Things like heart defects or problems with blood flow in the baby. That is why acetaminophen has always been the go-to choice. The FDA's advice is still use the lowest effective dose for the shortest necessary time. And talk to your doctor or pharmacist before making any changes. From my standpoint, I would say, true, there are studies possibly suggesting a small association. But the differences are tiny. 1.5% versus 1.3%. And the best evidence we have suggests genetics and environment probably play a bigger role than Tylenol. So for anyone who's pregnant, I wouldn't panic. I would not suddenly stop taking your medications based upon headlines. Always talk to your OBGYN or your pharmacist before making any changes. Tylenol is one of the most common medications prescribed for pain, fever, or both. No, Tylenol has not been proven to cause autism. The FDA is just being transparent about the evidence. And I'm here just to keep you informed and make sure to keep it real with you. If you found this helpful, please hit the like and subscribe button and share and drop a comment. Should Tylenol carry a warning label? Or does this just scare parents unnecessarily?